Austin's Morning News.
There are numerous positive results that occur when pediatricians have psychiatrists right there in the office. That's the story today in the Wall Street Journal as they report on a growing trend among pediatricians to embed psychiatrists in their practice right there in the office. The story says 20% of American children now meet the criteria for some sort of mental health challenges. And they have a further breakdown in the story in the Wall Street Journal. Kids in America ages 4 to 12, 7% have learning disabilities, up to 11% suffer from ADHD. And are you ready for this?
Okay.
31% suffer from anxiety disorders.
I'm crying bravo, Sierra, on that. Come on, that is crazy to me.
Let's go to Kevin in North Austin on KLBJ. Hey, Kevin, good morning.
Good morning, guys. It's kind of cold outside.
Yeah, buddy. It's hot in here, man.
You know, I think it's reasonable to listen to these doctors. I mean, they've gone to school for however many years. They are the professionals. And when are we going to start, listening to the doctors? I mean, but as a patient and as a parent, you do owe it to your child and, to yourself, if you're a patient, to seek, more than one diagnosis or to seek a second opinion or even a third opinion if you have some doubts. But at the end of the day, you need to listen to the doctors.
Kevin, well, at the end of the day, why are we having experts, and I mean people that are experts in the field, saying we are over-medicating our children? Well, and it's being over-medicated by doctors.
And don't you think this is a bit overkill, Kevin, too?
No, it sounds reasonable because I've been around a lot of children, and I've seen children that seem like something is wrong with them. And it's reasonable to believe that children have the same issues that adults have, but they just don't know how to deal with it emotionally like an adult. So they may need help. So, I mean, I don't see anything wrong with it.
And Kevin, to me, that's the role of the parent to do that.
Let me give you an example. All right, a kid's having a tantrum. That's stress, right? Yeah. So give a kid a pill. I can see how far you've got to look at this as what it is. This is a tsunami of money that's going to be paid out by insurance, and the cost of doing business is going to go up.
Okay, well, look, the money's got to go. If you need medication, get it. Now, there are some, like I said, as a parent and as a patient, you do owe it to yourself to get second and third opinions if you don't agree with it.
Back in the old day, you didn't get a pill for having a tantrum.
No, you didn't.
You got yanked up by the nape of your neck.
Okay, back in the old days, they didn't have Novocaine for a tooth when you got your tooth pulled either. There are advances.
No. That's a Novocaine shot that's temporary. We're talking about long-term stuff that these kids won't know what normal is.
Look, at the end of the day, you need to listen. I mean, you can pick and choose what doctors you want to listen to or what experts you want to listen to. You can always get an expert to disagree with popular opinion. That doesn't mean it's right. He's just disagreeing with it. But the ultimate decision is yours. If you want to medicate your child, if you feel that this will help, do it. If you don't.
Kevin, I just think, in some cases, your child may need medication. But for the most part, they need parents. They need guidance from people who've been parents before, pediatricians. I just don't see the need for a psychiatrist in a pediatrician's office. I'm sorry, I don't.
You can't see any circumstances where that would be warranted?
Very rare, Mark. Very rare circumstance.
Think about that guy at Connecticut at Sandy Hook.
Right. That was
as early as
tragedy.
First grade, he started exhibiting signs of serious mental illness.
Well, he's one of the few that would probably have needed it.
Let's go to Miley in Round Rock. Kevin, thank you for the call. Have a good day. Miley, Round Rock, you're on KLBJ. Good morning.
Yes, good morning. So I don't agree with I don't know that you need a psychiatrist in a pediatrician's office, but I think a psychologist in a pediatrician's office would be incredibly helpful. I have 2 kids. I'm not naming names because I know they wouldn't want their names out there on the radio.
That's fine.
Sam and Ed.
But my youngest suffers from severe anxiety, and it started when she was very young. We saw OCD-like behavior from her. I started taking her to a therapist, trying to work through her issues, talking, reading books, trying everything I could to help my child. It got so bad that a year ago my child was picking apart her food and was not eating. She dropped 6 pounds in 2 weeks because her anxiety was so far out of control, despite the therapy, despite everything I did as a parent, that we finally had to take her into a psychiatrist, and he said she absolutely needed medication. And she's on some, and she is so much better. She's finally gained the weight back.
There's always cases where kids do need medication, but my fear is that, when parents expect doctors and psychiatrists to do something, and what do they normally do?
Well, sometimes, Miley, you probably agree, some parents do need professional help when they've tried everything and nothing works for their child.
I agree with that.
Absolutely, yes.
And how old is your daughter, Miley?
She's 10 now. She'll be 11 in this April.
And
does the psychiatrist have any idea why she got into that state?
Why the anxiety got so bad?
Yes.
The anxiety, I believe, is inherited. I am like the biggest stress case you've ever met, and I suffered with it my entire life, not knowing what I was dealing with, just living through it. Now, mine never got to the point of what she did, but they don't know what. I mean, it was little triggers here and there that would set her off, and then the next thing we know, it's just out of control. It started with a boy throwing up.